Remember to subscribe and hit the bell icon to never miss an update from Dr. Mike Baby Care Channel.
Your pregnancy. Week 15. At 15 weeks pregnant, your baby is growing and maturing, and you likely have more energy and a lot less nausea. But as the baby gets bigger and bigger inside your belly, your body will start to change faster than ever. Pretty soon you'll be feeling your baby's kicks and somersaults, and in the blink of an eye, you'll be getting ready to meet them. Your baby's development at 15 weeks. At 15 weeks, your baby is as big as a pear. Your baby is forming taste buds, and nerves begin connecting them to the brain. But your baby doesn't actually taste what you're eating, so don't worry that she won't enjoy what you're having for dinner. Your little one's skeleton is starting to ossify. Which means, if an X-ray were taken today, his skeleton would be visible. Things are moving into place, namely your baby's ears and eyes. They continue the slow migration to their rightful spots on baby's face and head. Your baby's skin is still very thin and translucent, allowing a clear view of the blood vessels and skeleton. 15 weeks pregnant symptoms. As some of the first trimester symptoms subside, others might begin or continue into the second trimester. Symptoms you might experience during week 15 include increased sex drive. Now that your energy is back, you may be feeling more energetic in the bedroom as well. Of course, with all the other 15 weeks pregnant symptoms you may be feeling, if you're not up to sex, it's completely understandable. Nosebleeds. There is more blood flowing through your blood vessels, including the blood vessels in your nose. Occasionally those blood vessels break and bleed. It can catch you off guard, but nosebleeds are a common pregnancy complaint that about 1 in 5 pregnant people experience. The problem is generally mild and manageable, and it typically goes away after the baby is born. Swollen gums. Your gums are more sensitive now that you're pregnant, which can cause gingivitis or sore, red, swollen gums. Take extra good care of them. Brush your teeth often and floss gently. Continue regular dental visits. Shortness of breath. Notice that you're easily winded? Let's face it, it's getting more crowded in your torso. That means it might be trickier for your lungs to expand enough to get a full breath. Gaining weight. Starting in the second trimester, your baby's getting bigger and consequently, you should be too. Make slow and steady your motto and aim for a weekly weight gain of about 1 pound. But keep in mind that's an average, which means that it's perfectly fine to gain half a pound 1 week and 1.5 pounds the next, as long as you're netting about 4 pounds a month. Just be sure to do whatever your practitioner recommends on the weight gain front. Pregnancy checklist at 15 weeks pregnant. Start a pregnancy exercise routine. Begin tracking your weight to be sure you gain enough, but not too much. Eat healthy, balanced meals to get the nutrients you need. Make an appointment to see your dentist if you haven't yet. Discuss with your healthcare provider about prenatal genetic testing. By 15 weeks, you might be feeling pretty good. You might have more energy and an increased appetite. Be sure to get in some nutritious foods and regular exercise to help prevent gaining too much too quickly. Even though your bump is still small during week 15 of pregnancy, you're now in your second trimester and the baby has gotten much bigger. Enjoy your second trimester and start preparing for the rest of your pregnancy. Your baby will be here soon. Thank you for watching. Don't forget to subscribe.